Thank you, Governor Lee. Good morning, everyone. Thank you for joining us. The Tennessee Department of Health has received positive test results for the first case of COVID-19 in Tennessee, the illness caused by the novel coronavirus. The TDH State Public Health Laboratory tested the individual yesterday and has submitted results to the Centers for Disease Control and Prevention for confirmation. While we are saddened to learn that this virus has now reached Tennessee, our recent preparedness efforts that the governor just mentioned have positioned us to respond swiftly and thoroughly. We have been anticipating identification of COVID-19 cases in Tennessee, and we are now working closely with the CDC and local healthcare partners to identify this patient's contacts and contain the spread of this disease in our community. At this time, the overall risk to the general public remains low. The patient is an adult male in Middle Tennessee with a recent history of out-of-state travel. While we typically do not disclose county-level data on patients, given the recent severe weather impacts on some counties in Middle Tennessee, we are sharing that this patient is a resident of Williamson County. TDH staff have been in contact with this patient, and I have also personally spoken with him. He is currently isolated at home with mild symptoms. His household contacts are quarantined, they're at home, and are in the process of being monitored and evaluated for COVID-19. We continue to emphasize that the current risk to the general public remains low, and the same precautions taken with the flu should be taken with COVID-19. While this is a new disease, we have learned that most patients with COVID-19 have a mild respiratory illness, including fever, cough, and shortness of breath, and do not require hospitalization. However, a smaller number of patients can have severe symptoms that do require hospitalization, particularly among the elderly and those with chronic medical conditions. At this time, COVID-19 is not widespread in the United States, so no additional precautions are recommended for the general public. However, there are some things that citizens can do to prevent the spread of respiratory viruses like COVID-19 and seasonal influenza. TDH strongly encourages Tennesseans to wash your hands often with soap and water and use alcohol-based hand sanitizer if soap and water are not available. Cover your nose and mouth with a tissue when you cough and sneeze. Don't touch your eyes, nose, or mouth with unwashed hands. Stay home if you're sick, and avoid close contact with those who may be sick. Individuals with health concerns about COVID-19 should contact their medical providers. A growing amount of information can be found on our website, tn.gov/health, or through our trusted partner organizations at the CDC and World Health Organization. Before we go into the question and answer session, I will remind you that we just learned of this situation last night. We are committed to transparency and wanted to get this news to you as soon as possible. We know you want specifics on this case, but we want to be able to give you accurate information and to not speculate. Please be reassured that we are working diligently in the background to identify and contact those that were potentially exposed. And in our commitment to transparency, we will issue additional details as we learn specifics. That concludes my formal remarks.